onto the vaccine uptake in the country. Now, out of the almost 20,000 people who have so far been vaccinated across the country against COVID-19, 40 cases of minor side effects have been reported. The Ministry of Health citing that the cases do not in any way warrant investigations into the safety of the Oxford AstraZeneca vaccine. However, healthcare workers are still hesitant in taking the jab, despite the first phase targeting them among other frontline workers. Well, let's get more from our very own Raquel Mwachonda.
It has been 2 weeks since the first consignment of the Oxford AstraZeneca vaccine landed in the country. Counties getting a hold of their share days later on the 8th of this month. The Ministry of Health excited that 19,900 people have been vaccinated since, indicating that the process is going on well. That a representation of only 1.6% of the targeted population in the first phase.
And when I heard people saying there's hesitancy, I was taken aback as to how you can measure hesitancy within 2 days or 3 days. That would be very poor science. It is measured over a period of adequate time, because our phase 1 goes up to June. And for us, we want to measure uptake by week until we are able to cover the 125 million people we targeted. And I am sure we are going to surpass that.
But based on a meeting between the healthcare workers and the Senate Health Committee early on Wednesday, it appears that the ministry is not in touch with the reality on the ground. Leaders of various medical unions citing the hesitancy of their colleagues in taking the vaccine. The Kenya Progressive Nurses Association being practical about it.
80% of nurses say they will not get vaccinated, and reasons for not getting vaccinated is 59.8% site safety concerns, 19% efficacy concerns, and the rest is freedom of choice.
And when they asked if the nurses would encourage other members in society to take the jab,
45% say they are going to ask them to delay, while 13.8% will suggest that they do not get vaccinated. So you see from these findings, the nurses or the healthcare workers are not believing in the vaccine, and still they are the ones expected to give info to their clients, correct information, which they do not have for now.
Despite a section of healthcare workers expressing their hesitance in taking the jab, the Ministry of Health cites that until a direct link has been identified between the Oxford AstraZeneca jab and the side effects being reported, the vaccine remains to be safe. Preliminary reports by the European Medicine Agency and the World Health Organization showing no link this far, despite several countries in Europe suspending the use of the AstraZeneca vaccine, citing blood clots. Here in Kenya, 40 cases of minor side effects have been reported.
But none of them is serious to warrant an investigation. Majority of them are headache, a bit of muscle pain, and fever.
However, the side effects seem to be not so minor based on the ripple effect it has created in the health sector.
Just a simple example is healthcare workers who've had to actually take days off post the vaccine. Yes, it's expected, but these are things that because of the mild immune reaction that it triggers in the body. But these are issues that had not been explained to the doctors and the other healthcare workers, and so it is actually affecting service delivery at some point in the workplace.
622 centres will now be used as vaccination points from the initial 47, and they will include private, NGO or mission-sponsored hospitals, a measure that the ministry is using to reach out to as many people. This does not, however, change the minds of those who were meant to participate in the first phase of the vaccination campaign. Raquel Mwachonda, Citizen TV.